Very, very warm welcome to today's session, Better Nutrition through our Workforce Nutrition Alliance. I'm Sharon Bly. I'm the Global Director of Healthier Lives here at the Consumer Goods Forum, and very, very honoured to host this session along with wonderful stakeholders and partners that we have in Latin America. I just want to bring your attention to the interpretation that we have for today's session. At the bottom of your screen, you should see a small globe, and it will enable you to choose to switch between English and Spanish. And I'll just give everyone a moment to make themselves familiar with the interpretation because we will be switching between Spanish and English during this session. Great. So without further ado, I would like to hand it over to the Managing Director of the Consumer Goods Forum, Wei-Chan Chan, who will introduce the Consumer Goods Forum and, of course, our key partnership with all of you in Latin America and our hopes and our ambitions, along with the support of the First Lady of Colombia, to drive better nutrition in Colombia and across the region. So Wei-Chan Chan, I will hand it over to you. Thank you.
Yeah, thank you very much, Sharon. I hope everyone can hear me. And hola, everyone. Good to see you. And sorry that we can't be there in person, but it's very good to see you. And I see the First Lady. Welcome, First Lady. Very good to see you as well. And good to see everybody here. As Sharon mentioned, my name is Wei-Chan. I'm the Managing Director of the Consumer Goods Forum. And before we get started, maybe it's just a good idea just to talk very quickly about what the Consumer Goods Forum is, so that I understand that some of you might be quite new to what we do. So think of us as a quite a unique organization where we work together with retailers and manufacturers, i.e. brands, and we work together on a collaborative basis to solve common problems that we have. And some problems may be related to product data, some problems may be related to health and wellness, as we're talking about here, and some issues may be related to sustainability. So we work together as manufacturers and retailers on a pre-competitive basis, driven importantly by CEOs to drive action across a bunch of various different items. And that's kind of the in a nutshell what we try to do. And maybe it's probably just better to move on to the next page. If we move on to the next page and just describe it. So think of the Consumer Goods Forum really as doing two major buckets of things. One bucket is related to 8 coalitions. You can see the 8 coalitions here. I know it probably looks a little bit small, but there is a coalition on end-to-end value chain, which essentially looks at product data and how product data is transferred between manufacturer and retailer to execute a more efficient system. So that's one thing we do. Another thing we do, which is probably the focus of today, is the Collaboration for Healthier Lives. And this is a coalition where like-minded companies such as yourselves join together to try and affect change for healthier diets, also workforce nutrition. And so that those will be some of the topics that we'll be discussing today. And then we deal with a whole bunch of social and environmental sustainability topics. So food waste, which is essentially how do we reduce food waste as a leading group of companies? How do we reduce plastic waste? How do we improve circularity, which is really the plastic waste question? And then forest positive, how do we change our practices to ensure that whenever we buy product, that it doesn't result in a deforested forest, for example. We also deal with human rights as it relates to forced labor. So how does one prevent having forced labor within your own supply chains? And then on a sustainable supply chain basis, which is number 7, how do we work together to ensure that we get social compliance and also hopefully over time environmental compliance in our supply chains? So those are some of the sustainability topics that we deal with. And we also deal with safety, food safety. So we are well renowned for the GFSI, which is the Global Food Safety Initiative. And essentially that is a benchmarking process system whereby we govern food safety around the world for people who are part of that coalition. So those are the 8 things in terms of coalitions that we do, which are listed at the top there. And then there are a bunch of activities that we do, which is essentially think of them as events. So networking events, learning events. And those are the ones that we had on the bottom. So we have a summit, which we had a few weeks ago in Dublin. We have a Future Leaders Conference, which is essentially a program for young up-and-coming executives who will one day be CEO, and they're typically selected. to go on a training program on sustainability and strategy related topics. And then we have other smaller springboards, which is conferences and Sustainable Retail Summit and the Food Safety Conference as well. So those are things we do. So think of us as 8 coalitions and a bunch of activities related to networking and sharing of best practices. Maybe if we move on to the next page, Sharon. Yeah. And so specifically in Latin America, you can see that we have these various activities on the left-hand side. So we have plastic waste, food safety, and health and wellness. And you can see the various countries in which we're active in. So we're active in all of these various countries. And obviously today we're here to talk about health and nutrition. And I think it's very important that we as CGF member companies try to affect change as it relates to our workforces. Because if you add up, apparently, this is a statistic I've been given. So if you add up all of the employees that we have within the 400 or so members of CGF, which relates to obviously companies all around the world, we have about 10 million employees, which is quite a significant number of employees. And then imagine just being able to improve the health and nutrition of these employees. That's a major, major impact. So something that we should be doing and something that we should be walking the talk on. And I think it's very important that we do this. And so obviously, hopefully that's the first step for today as it relates to Latin America. And I hope that we can all join together with our partners, GAIN, to be able to move this topic forward and improve the nutrition. It's not just nutrition, but also the mental well-being of our employees and our staff. So that's really what I achieved today. And it's also a fantastic honor to have the First Lady of Colombia to be present with us today. As some of you may know, we are partnering with her on health and wellness throughout the region. She's very passionate about it, so passionate that she actually came by this to our office in France a couple of weeks ago. And we don't normally have many visitors, to be honest with you, especially in this current climate. So it was brilliant to see her there and just to hear from her, just to understand that she's passionate about the same topics that we are passionate about. And I do hope that we can form this collaborative relationship whereby we can push together this very, very important topic. And that's really why we're here today. So thank you very much for joining. And welcome, First Lady of Colombia. Good to see you again. And Sharon, do I hand back to you or do I hand over to the First Lady? I send straight over to First Lady. Okay, over to you. And very nice to see you again.
Muy buenos días. Un saludo especial, señor Wai Chan Chan. Para mí también es un gusto volverlos a encontrar. A Sharon, Miljan, mil gracias. Un saludo también, por supuesto, a toda la audiencia en Latinoamérica que nos está acompañando hoy en la virtualidad. Como bien decía el señor Chan, aún tenemos que valernos más de esas herramientas digitales para conectarnos, pero muy pronto seguro estaremos más cerca y de manera presencial podremos llevar a cabo estas reuniones. Para mí de verdad es un gusto estar con ustedes en esta mañana. Quiero dar un agradecimiento especial al Consumer Goods Forum y a GAIN, por supuesto, por haber propiciado este espacio en el marco de lo que comentaba el señor Chan, y es esa gran alianza por la nutrición que ha sido liderada por la Consejería Presidencial para la Niñez y la Adolescencia en Colombia, que ha estado a la cabeza de la consejera Carolina Salgado y que bajo su visión y liderazgo nos ha permitido hacer sinergia con muchos otros sectores. Desde ese escenario de la política pública que se lidera en la consejería, fue posible hacer energía y hacer de alguna manera alianzas coherentes, empáticas, a partir de la comprensión para unir esfuerzos en torno a causas comunes, a una que nos atañe como seres humanos absolutamente a todos, y es la nutrición, esencial para la vida. Y por supuesto llevarlo a un plano un poco de escala mayor, que es la seguridad alimentaria. Hoy que estemos convocados por el programa de Workforce Nutrition Alliance, para mí es tremendamente importante, teniendo al Consumer Goods Forum como un aliado priorizado en esa gran alianza por la nutrición en Colombia. Este programa de Workforce Nutrition Alliance realmente representa algo importantísimo, y es un escenario en el que los seres humanos pasamos casi un tercio de nuestra vida, y es el trabajo, el contexto laboral. Y de alguna manera, para mí se hace trascendental el conversarlo con los actores principales, con las organizaciones y las empresas, porque este es un escenario de gana-gana. Gana la empresa, gana la organización, ganan los empleados y con ello está ganando la sociedad en pleno, porque eso repercute en la familia de los empleados, en los entornos de los empleados, y finalmente eso es lo que queremos también hacer a través de la alianza. Reconocer un poco el impacto que tienen quizás pequeñas acciones en generar unas bondades colectivas enormes para la sociedad. Esto yo creo que de alguna manera también que se esté dando, que tengamos convocados a Latinoamérica desde ese escenario del sector privado, es una representación genuina del compromiso que se hace también con la inversión social, con la fuerza laboral, que de alguna manera reconoce pues los beneficios que tiene un sector que pareciera ajeno para muchos, que es la nutrición, pero finalmente estamos hablando de salud y de algo que para mí es esencial, y es el bienestar. Seguro muchos conocen la definición exacta de esa palabra, pero para mí es tremendamente valiosa, y es que el bienestar es ese conjunto de cosas que son necesarias para vivir bien. Entonces, ¿por qué no ese escenario laboral y ese escenario de empresa convertirlo en un escenario absoluto de bienestar? Y es lo que yo he visto en el trabajo que realiza el Workforce Nutrition Alliance, y por eso estoy convencida que tiene un impacto realmente positivo, un impacto integral en aspectos que van más allá, como lo decía antes, de beneficiar un empleado o de beneficiar una comunidad particular. Y es que con este trabajo hay aspectos que se tocan de una manera bondadosa, y es ese impacto positivo que se genera en la salud mental, como lo mencionaban ahora, en la seguridad, en el estado físico, inclusive que tiene un alcance que muchas veces no se ve por tratarse de un tema quizás muy humano, de concebir la nutrición como un aspecto quizás muy individualizado, pero la realidad es que el invertir desde la nutrición en la sociedad tiene un impacto económico y financiero significativo, no solo en la productividad personal, sino también, por supuesto, en la productividad a nivel empresarial y de organizaciones. A mí me gustaría, en ese sentido, compartirles cuál ha sido la experiencia de Colombia, cómo hemos liderado y desarrollado todo el proceso de la alianza para vincular distintos sectores, para concientizarlos, y por supuesto para que esta experiencia ojalá se convierta en ese elemento para que muchos decidan sumarse al Workforce Nutrition Alliance, y que sea una nueva manera de concebir el bienestar y la responsabilidad social para muchas empresas y organizaciones. En la Gran Alianza por la Nutrición logramos, con ese liderazgo de la consejería, como lo decía antes, coordinar trabajos, coordinar esfuerzos y lograr que aliados extraordinarios como el Grupo Éxito, que ustedes conocen bien, Consumer Good Forum en general, se hayan unido y confirmen la efectividad que tiene el trabajo articulado, multisectorial, y sobre todo la pertinencia de actuar con un foco definido, con lo que nosotros hemos llamado una causa común, y es definir metas muy concretas. En este caso para nosotros fue esa ruta que nos trazaba el Objetivo de Desarrollo Sostenible 2, que es hambre cero, y decidimos desde el marco de la alianza trabajar todos unidos bajo ese propósito colectivo de combatir y erradicar progresivamente las muertes por desnutrición en los niños en Colombia, y ampliarlo a un contexto de seguridad alimentaria. Entonces, en esas premisas, logramos fortalecer estrategias, intervenciones de alto impacto en la nutrición, que ya se venían haciendo algunas de ellas de manera desagregada, que nosotros logramos reunir y potenciar para que llegaran a más actores y abarcar un espectro muy amplio. Y fue abordar, por ejemplo, a la mujer gestante o lactante, a los niños y niñas, buscando, por supuesto, que en esos primeros 1000 días de vida alcancen un potencial máximo de su desarrollo cognitivo, físico y emocional. Y esos dos escenarios los abordamos con algo muy puntual, que fue la lactancia materna. Desde la gestación, concientizando y trabajando con las mujeres y con las madres gestantes sobre esa bondad y ese realmente acto único de donde convergen la nutrición en cuerpo y alma, que es la lactancia materna. Y abordando también no solamente ese contexto humano, sino algo fundamental, y es con hechos, con data, con evidencia, lograr mostrar el impacto que tiene la lactancia materna para combatir la desnutrición crónica, la desnutrición aguda, la anemia, y de la misma manera poder expresar claramente por qué un acto tan sencillo como la lactancia materna aporta finalmente al desarrollo del capital humano y con eso a la productividad de los seres humanos. Entonces, en ese contexto de lactancia materna, contamos con aliados extraordinarios que desde la empresa y desde el sector privado empezaron a generar escenarios que fueran aptos para que las mujeres que trabajan pudieran tener espacios para lactar, generar algunas políticas internas sencillas que fueran más amigables con la lactancia materna. Incluso llegamos a generar también algunos espacios en donde pareciera no tener un impacto directo, como los parques infantiles o parques temáticos, para que fueran amigables con la lactancia materna, y generamos espacios que terminan finalmente repercutiendo en toda la familia. El año pasado se presentó adicionalmente en el país el plan decenal de lactancia materna y alimentación complementaria. Es un plan decenal que tiene una particularidad extraordinaria, y es que fue construido primero teniendo en cuenta cuáles habían sido esas fallas o esas carencias del plan decenal anterior, considerando a todo el territorio nacional, entendiendo que somos un país tremendamente diverso y que en medio de esa diversidad necesitábamos unirnos en esa causa común de la lactancia materna y la alimentación complementaria, y sobre todo teniendo en cuenta la evidencia, como ya lo mencioné, la data y una capacidad de medir el impacto de ese plan decenal de lactancia materna. Y para eso nos apalancamos con todo el territorio nacional. Trabajamos no solamente con la empresa privada, sino con los entes territoriales, con las alcaldías, con las gobernaciones, con las gestoras sociales, que son, para quienes no lo conocen, las primeras damas de departamentos y municipios, para generar esa conciencia colectiva del aporte que tiene la lactancia materna en la nutrición. Y esto, por supuesto, además lo fuimos complementando con acciones muy concretas, de acciones estratégicas que yo creo que son también una prioridad, y algo que en el Consumer Good Forums, que GAIN han venido estableciendo para tener un impacto y un alcance mayor. Y es, por ejemplo, la potencia que tiene la comunicación, la capacidad que genera el poder compartir experiencias exitosas, y sobre todo el reconocer también muchas de esas experiencias para seguir animando y motivando a que muchos de estos programas y estas acciones se lleven a cabo. Así como la comunicación es relevante, nosotros también le dimos muchísima importancia a todas las herramientas pedagógicas, y por eso diseñamos y pusimos a disposición, digamos, de toda la comunidad algunos cursos sencillos de estilos de vida saludable, atención y además información concreta desde el punto de vista científico, médico, para adolescentes y jóvenes, y contextos que realmente le permitieran a la comunidad acercarse a esa noción de nutrición y de seguridad alimentaria. Eso no es posible sino únicamente gracias al trabajo colaborativo, al trabajo conjunto, al trabajo y a la visión articulada de muchos actores. Y yo creo que esa es también otra de las grandes verdades que tiene el trabajo que se aborda desde este escenario, y es que la diversidad que nosotros podemos decir que vivimos en Colombia, hoy se vive en las empresas vistas desde el contexto de Latinoamérica, y el cómo se pueden unir todas en esa causa común de generar beneficios para sus empleados y sus familias. Pasando de la lactancia materna, nosotros quisimos dar otro enfoque que a hoy siento tremendamente pertinente para el sector privado, para las empresas que nos acompañan hoy, y es el incluir una conciencia absoluta, clara, manejada bajo esas mismas premisas de comunicación, de evidencia, de data, frente al manejo responsable de las pérdidas y desperdicios. Ese es otro contexto que casi que nos lleva del inicio de la cadena de la seguridad alimentaria al final, y es el inicio con la lactancia materna y con lo que implica el detonar esas capacidades cognitivas y de desarrollo humano en los ciudadanos, y al mismo tiempo, al final de la cadena, cómo tenemos un compromiso también social de responder a una mejor administración de pérdidas y desperdicios, algo que está tremendamente asociado a la empresa privada, que hoy se convierte más que nunca en un elemento de responsabilidad social empresarial, y que adicionalmente también reporta, al igual que una adecuada nutrición, un beneficio en la productividad y, digámoslo claramente, en las finanzas y en el resultado económico y en el balance costo-beneficio de una empresa. Nosotros, en ese sentido, pudimos trabajar de manera nacional, abordando una reglamentación nacional para la prevención y reducción de pérdidas y desperdicios de alimentos. Es la primera vez que se aborda desde la normativa este tema para Colombia. Es una normativa que incorpora adicionalmente acciones intersectoriales que involucran al sector público, el sector privado, la sociedad civil, la academia y a los demás actores, para mejorar y tener en cuenta el circuito completo de la seguridad alimentaria, los ciclos de abastecimiento, de comercialización, de preparación de alimentos, y por supuesto desde el sector primario hasta las prácticas ya muy concretas en los hogares. Acá estoy segura que hay muchísimas empresas que además están ligadas al sector de alimento, con esa conciencia social y con esa conciencia también ambiental. Y ese es otro de los aspectos que yo quisiera rescatar de esos dos escenarios en los que nos hemos movido en la alianza, y es que los dos dejan unos beneficios sociales muy oportunos para el mundo que estamos viviendo. La responsabilidad social empresarial hoy tiene que estar consciente del empleado y del entorno. Y estas dos acciones a nosotros nos reportaron un beneficio que definitivamente impacta de manera positiva esos dos escenarios. ¿Cómo se traduce todo esto? En que definitivamente el trabajo colaborativo potencia los resultados, los hace efectivos, eficientes, y adicionalmente nos ayuda a encontrarnos en sectores y en acciones que nos unen como seres humanos. Cuando el sector privado trasciende un poco esos estereotipos, en este caso concreto, sobre la capacidad que tiene frente a un objetivo tan concreto como la nutrición, empiezan a ampliarse, por supuesto, las visiones, las acciones, con algo que para mí ha sido esencial, y es la corresponsabilidad. Eso para mí es un principio social irrenunciable, y es un principio al que las empresas están abocadas. Esto nos permite, por supuesto, reconocer también de manera evidente el aporte que hace el sector privado, no solamente con la obligatoriedad de la responsabilidad social empresarial, sino también como un agente externo que está aportando a la sociedad en pleno y que adicionalmente puede encontrar una afinidad y una posibilidad de trabajar aliado con una política pública, que fue el caso de Colombia. Logramos no solamente unirnos en esa causa común de la nutrición con sector privado, sector público, organismos internacionales, sociedad civil, sino que logramos que ese actuar estuviera también alineado con la política pública, con la visión de Estado que tiene Colombia frente a la nutrición. Y pues para no aburrirlos más con esta historia, simplemente creo que todo esto que he compartido es definitivamente una oportunidad que se puede proyectar en un programa como el Workforce Nutrition Alliance. No tengo duda alguna de que invertir en la nutrición de la fuerza laboral genera un retorno que se mide en calidad de vida, no solamente para el empleado, sino para sus familias, que repercute en la productividad de manera evidente y que adicionalmente es una oportunidad única para que esto se extienda a toda la región y veamos a una Latinoamérica nutrida en cuerpo y alma. Muchísimas gracias.
Wonderful. Thank you so much, First Lady, for those inspiring words. You give us the passion and the commitment to continue to driving this agenda globally, and obviously showcasing leadership across Colombia and the region of Latin America. So you can rest assured that the Consumer Goods Forum will fully support your message across all of the member companies that we have. And again, a huge thank you for your support, and that message about the win-win situation of investing in health is for society as a whole, for everyone listening on this call. And before we deep dive into the Workforce Nutrition Alliance that we're showcasing here today, I just wanted to give you a very short overview of the Healthier Lives Coalition of Action here at the Consumer Goods Forum and the future ambition that we have across all of our member organizations to walk the talk with our own people. Wei Chan mentioned 10 million people that work for all of our member companies, and that goes up to 90 million people that are working along supply chains across the food industry globally. So the impact that we can have is absolutely tremendous. We want to really step up and take that responsibility and put a stake in the ground going forward on what we can do to look after the mental and physical health of all of those people working across our member companies. We also have a sphere of influence in communities where all of our member companies operate, and a sphere of influence in the baskets, so supermarkets and stores and online environments where we interact with people on a daily basis. We're part of people's daily lives, and the role and the influence that we have on helping people to make those better choices in their baskets and to inspire people all around the globe to live healthier and more sustainable lives. We are putting a focus on supporting people in those choices, and of course, access, affordability, desirability of healthier and more sustainable options are critical to everything we do. We want to work in an honest and transparent way across this coalition by providing information by clear, transparent labeling, and helping people, whether it's things like cooking, inspiring younger generations to want to live healthier and more sustainable lives, and of course, working on prevention and reaching some of the most vulnerable communities that we have across the globe. So we're a very, I would say, global goals and global purposes around healthier lives, but we work absolutely on a local level, community by community, store by store, neighborhood by neighborhood. And in Latin America, I'm very thrilled to work with such amazing partners in Colombia. And we've been really inspired by the Grand Nutrition, the Grand Alliance for Nutrition that is in Colombia, and that multi-stakeholder way of working that the First Lady mentioned is key for impact on the ground. I think we've really seen that those partnerships working across private, public sectors can really bring us to raising awareness around health and wellness, but also going from awareness to impact and changing habits for good across people's lives. So here you can see some of the results that we've had from our work in Colombia, and we're really thrilled to continue to emphasize our work in Colombia, and we hope that Colombia will be a model that inspires other countries to work in stores, online, and with employees across the region. We also work in Costa Rica and in Mexico, where Costa Rica has shown a lot of leadership around the intersection of health and sustainability, and how we can inspire people to live a conscious way of life, and how we can, of course, meet people to help them with their needs around living healthier lives. And Mexico, again, a great collaboration and raising of awareness around health and well-being. And we also have, as in Colombia, worked in partnership with some of the food banks, where we know that food security and access to health and nutrition can be a challenge in countries not only in Latin America, but across the globe. So we've done some very concrete actions on the ground and collaboration with food banks across the region. So we want to continue to build on these collaborative actions that we have in Latin America, and include more and more people in this. And as I mentioned, in Latin America, but also globally, stepping up our action and taking that responsibility to walk the talk on employee health and well-being. And a really concrete action that all of you can take today that are listening is to get involved in our Workforce Nutrition Alliance. It is a really key partnership for us that we have across the globe with GAIN, which is a global alliance for improved nutrition. It is something that is building in terms of implementation across the globe, and we're obviously thrilled to have the First Lady as one of our key advocates in Latin America. And so I'd like to introduce my partner from the Global Alliance for Improved Nutrition, Miriam Knepkins. We have a great team working around the world that would be thrilled to work with any of you on deep dives on how the Workforce Nutrition Alliance can support your ambition and your role in society to look after, firstly, the people who work for your organization. So Miriam, I'll hand it over to you to bring us into more of the details on what we can do and what you can practically do today in your organization to get on board. So Miriam, it's over to you.
Thank you very much, Sharon, and thank you all. It's an honor to be here today. So I want to talk indeed about workforce nutrition and how you could start with this in your own organization. So first of all, why the topic of workforce nutrition? And knowing that 1 in 3 people worldwide are malnourished, and at the same time, we're spending so much time of our lives at the workplace. The working adult population spends 1/3 of their adult lives at work. And at the same time, nutrition impacts societies, companies, individuals. So combining all of these facts, really it only makes sense to start intervening at the workplace, and you can imagine what an impact employers can have on the lives of their employees. So the Workforce Nutrition Alliance aims to support those employers to adopt and to expand workforce nutrition programs, and we want to reach people in their companies, in their supply chains, 3 million employees by 2025 and 10 million employees by 2030. And we cannot do that alone, of course, and that's also why we're here with you today, because we want to join forces with people from all across the world to really make this happen and to really make an impact in people's lives. So when we talk about workforce nutrition, we think about 4 different areas. And the first one is healthy food at work. So really creating a healthier environment where people can make healthy choices, where canteen meals are healthier, for example, or where they can have a fruit as a snack, to mention something. But also, of course, there can be an educational aspect to it. Nutrition education can be a really important addition to a workforce nutrition program. It could be health checks. Some companies are already doing general health checks once a year, maybe. And you can add, as a company, you can add a nutrition component to that to help people understand what is their current status when it comes to nutrition, and also ideally combine it with follow-up counseling so that people can actually make a change in their life and make a change to their lifestyle. So not only helping people understand where they are, but also helping them move to healthier choices, healthier diets. And the last area where we also encourage companies to do something is breastfeeding support. And this is really to support people who are getting back to the workplace after having given birth, to support them and to continue breastfeeding if they would want to do so. And when we look at all the aspects of employee well-being, and actually Deloitte made a report on this, Healthy People, Healthy Business, and they are looking at these 5 different areas of employee well-being. And they mentioned the Workforce Nutrition Alliance related to the physical aspect of employee well-being. So improving health and nutrition status, but actually, if you look a little bit closer, you see that workforce nutrition can also be linked to all of these 5 elements. And it's really central to employee well-being, and it can be a catalyzer for other themes as well. First of all, there is the social aspect. So we see that companies are building stronger relations with their employees if they are investing in their nutrition. People feel really seen and appreciated. There is the mental aspect. As you can imagine, if you eat better, you feel better. And if you feel better, you eat better. So there is a very clear correlation there as well. And then there is health and safety. So, for example, if you haven't eaten for a long time, your concentration may drop and you are more likely to get into accidents or to lose your concentration at work. So nutrition can make a big difference there as well. So we talked about the physical aspect already, but of course, there's also a financial aspect to it, reducing absenteeism, having higher work capacity, productivity, etc. And then if we look a bit further at the benefits of workforce nutrition and why companies are investing in it, we see we often divide it into benefits for local work sites, for a factory, for example, or a local office, and then also the benefits for global organizations, for big companies that may have very higher number of work sites across the country or across the world. And to first zoom in on those local work sites, well, there's 3 main areas where we see benefits. So the first one is investing in the health and safety of your people. So really enhancing their nutrition, their health, and their well-being. The second one is staff turnover and satisfaction. So I mentioned those relationships, the social aspect, but this is of course also really a business benefit because you're retaining the good people, you're keeping them with the company, you're attracting new talent, and you're building loyalty and you're building satisfaction among your work site. And then of course there is the financial aspect, the worksite profitability. And we see in literature that there is actually a very good financial reason to invest in workforce nutrition as well. There is a 1 to 3 return on investment when you invest in breastfeeding programs. This could be because children are sick less often if they are being breastfed, so parents don't have to take leave as often to take care of their sick children. It could also be because people who are returning back to the workplace, they feel supported to continue working, and they make a decision to continue working instead of being home by their children to be able to continue breastfeeding. So there's really a financial reason to invest in this as well. And especially also if you look into broader health and well-being programs that include a comprehensive nutrition component, there's even a 1 to 6 return on investment. And then if we look at benefits for global brands, we also see 3 areas. And the first one being really investing in the supply chain, in continuous supply, ensuring also future supply, and really building the quality in your supply chain. Then the second one, brand equity. So building your reputation as a global company, demonstrating corporate citizenship, increasing social value, and really getting recognition for the things that you're doing for the people that are working for your company. And of course, there's also the aspect of reporting, which is important to many companies. So for example, workforce nutrition is included in the World Benchmarking Alliance, in the Access to Nutrition Index, but also companies can include it in their ESG reporting on livelihoods and gender equality approaches. So there's a link here also to a report from the Access to Nutrition Initiative, and we will put it in the chat as well, that gives some case studies of companies investing in workforce nutrition. So what are their reasons to invest, and what are the benefits they are experiencing? So to zoom a little bit in on those benchmarks, we have the Access to Nutrition Index ranking 25 global food companies, and then also the World Benchmarking Alliance ranking 350 companies worldwide. And with improving workforce nutrition, companies can also increase their scores in these global benchmarks. And then, of course, companies can also add this to their ESG reporting, to voluntarily report on what they are doing on workforce nutrition. And if you decide to invest as a company or to expand what you're currently doing, you're in very good company. We've had the pleasure to work with these wonderful names listed here, and we're very excited to work with these frontrunners and to also expand this list and make an impact worldwide. So as we continue, I would like to talk a little bit further about if you feel that workforce nutrition could be relevant to your company, what is it? Where do you want to start? So how are you building your strategy? And the first thing we recommend to companies is to conduct a self-assessment. So where do you stand and what are the opportunities to improve? Then secondly, after that, you would look into, okay, how am I planning for implementation? How can I develop programs that are impactful, that are cost effective, that fit with my business? Of course, when you start implementation, you also want to monitor. So we encourage companies to monitor their progress using those KPIs that are aligned with the World Benchmarking Alliance, with ADME, with all the global standards. And then as a last step, of course, you're showing your success, talking about what you're doing as a company, tell impactful stories, and report on it. And one thing that's very powerful in developing that strategy is to consider both the company as a whole and also those individual work sites. Many companies will have different work sites that are in very different settings. They may have maybe located in different regions, different countries even, and their workforces and the challenges that their workforce has might be very different, and the opportunities to intervene as well. So it's really important to set out a strategy as a global company, as a national company, and indicate that you find this important, that this is important to the company. We want to invest in it. We want to do something about it, but then have very local implementation as well, and really look at those specific work sites. What is it, what we can do? What are the opportunities? And how do we develop something that really fits with the people that are working here? Because as you can imagine, workforce nutrition and nutrition in general can be a very sensitive topic, because people don't want you to take away any of their favorite foods. So it's always good to really look at the context, talk to the people, talk to employees. What do they want? What are they struggling with when it comes to nutrition? And then looking a little bit closer at the self-assessment scorecard. This is a really easy tool that we've developed for you as the Workforce Nutrition Alliance, and we've tested it with 34 organizations worldwide. 115 work sites have filled it out already, and across 30 different countries. So you're in good company when you start this self-assessment, and it's really easy actually. It's just asking you a few questions on each of those different areas of workforce nutrition, asking you a few questions like, what are you currently doing? What is the quality of your programs? What is the quantity? How many people are reached within the organization? And then also, is it embedded in your strategy? Are you measuring? Are you monitoring what you're doing? So we're just asking some basic questions to give you an indication, like, where do you stand currently? Are you at beginner level or bronze or silver or gold? And what are the areas where you can improve? So it also gives some inspiration on the things you could be improving on. So as a second step, once you know a little bit better where you stand, we also have free guidebooks available. They are on the website. We will share a link to the guidebooks. And this is just giving you some information on, like, what is the evidence for this area of work? Like, why would you be investing in healthy food at work or breastfeeding support? What are some case studies from other companies? And then it talks you through some very simple solutions. Like, if you want to do something on this topic, this is what you can be thinking about. This is what we recommend as the Workforce Nutrition Alliance. So this is really where you can start as a company. And that can be very simple solutions. It can be a very comprehensive program, anything in between. Even if you make a small change in your organization, it's already making an impact. So we definitely encourage you to start small. If it's if it's something you're interested in, but you do not know quite yet where to start, just start small, and you can continue and increase along the way. So today we also want to show you an example of LatAm Group and how they have looked at the scorecard, because they have filled it out across their work sites, because they want to do something on nutrition in all of their work sites, and they have set the goal for themselves that by 2030 all of their staff will have access to nutrition programs. And the goal they have set for themselves is that all of their work sites are ranked in the bronze category of the self-assessment scorecard by 2030. So these are some of the indicators that they are looking at. So they wanted to know a little bit more details when they are looking at what their companies are doing. So not just the scorecard results that we will look at in a second, but also a little bit more details, like how many of our employees do have access to the meals, how many employees do have access to nutrition education, to health checks, what are we doing on breastfeeding support. So these are the type of things that they are reporting on internally and to their board on what they're doing on workforce nutrition. And then this is what it looks like for them to have an overview of their different work sites in different countries. So we see Nigeria, Mozambique, Cameroon, for example, and all of these work sites have filled out the self-assessment scorecard, and they got an indication how they are doing on workforce nutrition. So as you can see, on the top here, we have some companies who are scoring silver. Then there is a number of companies that are scoring bronze. and there is a number of companies that are at beginner level. And the colors are representing the different areas of workforce nutrition. So blue indicates that they are doing something on healthy food at work. Green indicates nutrition in education. Then orange is nutrition-focused health checks, and purple is breastfeeding support. And as you may remember, their ambition is for all of these companies to go to the bronze standard that we see here at 25 points. So we thought with them about some of the strategies that they could take. For example, they could be looking at these work sites that are still at beginner level. As you can see, none of these work sites are already doing something on nutrition education. So they could simply add a nutrition education element to their program. And look at that, there is actually some other work sites that they may be able to learn from, because we have some companies in Nigeria and Mozambique who already have strong nutrition education components. So they may be able to share some of their learning, share some of their materials with those other work sites, especially when they are in the same country. There is so much opportunity to learn and share internally. Or they could decide to focus on a cluster of work sites that are in the same country and that may face the same challenges, may be able to benefit from the same type of solution. So they could also link those work sites to each other. Another option would be to focus on a theme like breastfeeding support, because these companies, as you can see, are not doing so much yet. Some of them are doing a little bit, but not doing so much yet on breastfeeding support. So there's definitely room to improve on that specific topic as well. And who knows, it may look like this when we are doing the same process in 2030. And LatAm is, they just started on this journey, but every year they're doing this scorecard assessment again to see how they are improving, what the opportunities are, and how these different work sites can learn from each other. So, of course, as an alliance, we want to support companies in their journey towards improved nutrition, improved workforce nutrition. And when we talk to companies, we often see, well, three different type of people that we're working with. So there is people that we call global leads, so who are making a decision are responsible for the whole company, whether that's a global or a national company. They are responsible for the whole company to set out the strategy for workforce nutrition. And they need to make the consideration like, what are the potential benefits? What are the impacts? How many funds do we want to allocate for it as a company? And they are then also in a position to encourage those different work sites to actually start doing something on this topic, because as we talked about earlier, it is so important for work sites to be in the lead, to feel empowered that they are in the position to take action on this topic. So then we have the worksite managers who we really need to endorse workforce nutrition as a priority, to allocate time and resources, and then also to look internally, like who is the person that is going to lead this and that is really going to be the focal point of this program for my specific worksite. And that is often someone, as we've listed here on the right, someone in the HR department, but it could also be in the sustainability department, that, or a different department even, that depends very much on the company structure. But these are the people that are designing a tailored program that is relevant for their specific setting and that are gathering a small team to ensure successful implementation. And as an alliance, we started developing resources for these three different groups of people. So first, there is what we call the Fast Track for Leaders. This is two 1-hour webinars where we talk about developing the strategy, planning for implementation across the company. There is the Roadmap to Implementation session that is really focusing on worksite managers, like what are the benefits for your specific work sites, but also what does it mean in practice? What makes a successful program? And then we have a workforce nutrition masterclass. And this is really a 3-month program where we are working intensively with those, with representative from different companies. And it's really this small group where we can learn from experts, learn from each other, discuss our challenges. We have many tools and resources available. It's one-on-one coaching included. And we're really working with these specific work sites to guide them through the process of setting up a workforce nutrition program. And this has been really powerful. We're hosting the second cohort in September, but this is in English. But next year in March, we're actually starting a cohort in Spanish as well. So if you would be interested in this, please feel free to reach out to me, to our CGF colleagues. And we're starting the Fast Track for Leaders in October. The dates are listed here. The Roadmap to Implementation in November, and then the Workforce Nutrition Masterclass in March next year. So just to close today's session with, just a reminder on why we're doing this, why we're focusing on this topic. And that is really because workforce nutrition can deliver so much benefits, not only to employers, but also to workers and to even to communities. So it's such a powerful topic to work on. And I'm so glad that we're here today together to really take action on this. So thank you very much. And I think we have some time for Q&A now.
Thank you so much, everyone. I see that we've had some Q&A that's come through in the chat, but I believe we have replied to all of the questions, and I just want to reiterate the support that is here. I hope we have convinced you, along with a call to action from the First Lady, to really work with us on this win-win situation where we really want to drive better nutrition for society as a whole, and we really see the workplace as the perfect way to really get impact at scale in Colombia, but across the entire region. So maybe what I will do is I'll leave maybe the closing word to the First Lady as we close off today's webinar.
Muchísimas gracias, Sharon. Pues como lo dije, creo que no cabe duda que el trabajo multisectorial, colaborativo, que tiene un objetivo común y en particular en este caso con la nutrición, un objetivo que impacta lo más esencial que tenemos, que es el desarrollo del capital humano, no da espera. Y es una extraordinaria oportunidad para trabajar unidos y para aportar sobre todo al futuro de nuevas generaciones bajo ese mundo que soñamos.
Thank you so much, everyone. Muchas gracias. And please do reach out to us. Thank you again, First Lady, for all of your inspiration, your passion, and your commitment. We look forward to continuing our work together. Thank you, everyone.